is your question? Right. So if you have read and understood, considering a history-taking station, kindly begin.
Hello, I'm Dr. Ulfat. I'm one of the surgical doctors working here. Can I please confirm your name and age, please?
Okay. I'm Mr. Smith, John. I'm 56 years old.
Nice to meet you, Mr. Smith. Can you please tell me why have you come here today?
Yes, I've been having my urine has blood, my pee.
Oh, I'm so sorry to hear that. For how long have you been noticing this?
5 weeks now.
Okay. And are you sure that you're passing blood through your urine and it is not from anywhere else?
Yes, I'm sure.
Okay. So is it like it's always there, or just is there? It comes on and off.
No, it's always there.
Okay. And do you notice that the blood? Do you see it like all throughout the stream, or is it at the beginning or at the end?
It's throughout.
Okay. Do you notice any lumps, any clots that you might be passing?
Occasionally, there is clot.
Okay. Do you have any pain in your tummy?
Yes,
or
I
your
have pain.
back?
I have pain on the left side, on my left side.
Oh, I'm so sorry to hear that. Is that pain always there, or does it just come and go?
Yeah, I started since 2 days, and I think it has been there since that time. But
Okay.
occasionally it comes from the loins and then down to my groin. That's where it comes.
Oh.
It used to be.
Oh, I'm so sorry to hear that. Could you please tell me, how would you describe this pain? Is it like a dull pain, or does it like come squeezing sort of pain?
Is it dull? It's dull.
It's dull. Okay. Is there something that makes the pain worse, or something that improves it?
The pain is better if I take paracetamol. I feel better.
Okay.
The pain is low.
All right. If you would have to rate the pain, with 1 being the no pain to 10 being the worst imaginable pain, how much would you rate it?
6.
Okay. All right. And what about your waterworks? Do you have to go often to the bathroom?
Yes, I go off more frequently now, occasionally. It's more frequent than before.
Do you feel like, do you feel a sense of incomplete voiding after you come back?
No.
Okay. Do you ever have to wake up at night to use the loo?
Yes.
Okay. And what about, do you have any history of falling down, or history of fall, or history of getting hurt in your tummy?
No, doctor.
Okay. Have you traveled recently abroad?
No.
Okay. Do you feel like you've noticed? Do you notice any unintentional weight loss?
Yes, I've lost weight.
How much would that be about?
Well, about 5 pounds the last time I checked.
Okay. And what about your appetite?
Yeah, I don't like eating. I don't know why. I don't have appetite like before.
Okay. And do you see your general practitioner for any medical condition?
Yes, I'm hypertensive for about 10 years, and I'm using drugs by my I'm using medication by my GP. Given to me.
Okay. All right. What do you think? What could you be suffering from?
I'm just worried that I hope what is causing the bleeding is not something severe. It's not normal for pee to have blood. So I'm really, really worried that it's not something dangerous.
Okay. What are you most concerned about?
I want the urine to be clear, normal again. That's what I want.
And what would you like us to do for you?
Yes, my urine to be fine. No pain. Urine is clear. My pee is clear, and I can go back home. And
you said that you take medications, right?
yes.
Is there any other medications other than an antihypertensive that you take?
No, that's just the only one. The only hypertensive.
Okay. All right. And do you know the name of the medication you take?
Amlodipine.
Okay, amlodipine. Can you please tell me, have you had any operations?
No.
Okay. Are you aware of any allergies you might be having?
No. I don't have allergy.
Okay. Can you summarize your history now, please?
Okay. I have taken history from Mr. Smith, a 56-year-old man who complains of passing blood in urine, hematuria, for the past 5 weeks, and associated he also complains of urinary post-voiding urinary incontinence frequency, and loss of appetite, and significant weight loss, he is concerned about that it might be possibly something life-threatening. That is why he sought medical attention. Due to a lack of time, I could not ask him personal history to find if he has any occupation like working in a factory. And he also gives history, and I could not ask whether he's a smoker, and he's a hypertensive patient he's a controlled hypertensive patient. Yeah.
According to the history that you have taken, what is your provisional and differential diagnosis?
According to the symptoms that he's presented with, my provisional diagnosis would be bladder carcinoma, but I would like to keep some differentials, like it could be a renal cell carcinoma, it could be urinary tract infection, it could be calculi in the urinary tract, perhaps in the kidney, in the ureter, or in the bladder.
How do you
it could also be a bleeding disorder.
Yes, how do you intend to manage this patient? Investigation, I would like treatment, please.
Yes, I would like to, after taking a thorough history of the patient, I would like to refer to some of the notes that his general practitioner might provide. And I would like to do a thorough clinical examination of the patient, which would include the general examination, abdominal examination, along with the digital rectal examination. I would do some investigations. Firstly, I would do some blood investigations where I would see the full blood count to see anemia the patient might be having. Then I would like to do urine dipstick test for urine routine examination and culture cytology. I would like to also do CT scan, CTI view.
Have you told me the treatments?
No, ma'am. Treatment would depend upon the, if this is a bladder carcinoma, treatment would depend upon the stage and grading of the patient. And I would like to go for surgical management in early cases. That is,
after discussing with MDT.
After discussing with the multidisciplinary team.
Yes.
And I would like to go for transurethral resection of bladder tumor, or a partial or radical cystectomy with or without ileal conduit, or I would like to go for palliative treatment if it is an advanced case. In that case, a chemotherapy, radiotherapy, or I would even consider immunotherapy.
Good, thank you.